Hello everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS. And let's continue the success course of the UKMLA 2 exam. So in the previous three lectures, what we discussed was the basic introduction and the basic aspects and the different type of stations that are covered in the PLAB 2 exam and how to identify them and what mindset you should have when you are starting to prepare for the PLAB 2 exam. Now, the upcoming lectures would be directly the content that needs to be taught, and step by step we'll take one thing at a time, right from the introduction to the structures of different type of station, different type of consultation, what is the approach that we should have. Other than that, we'll see how the management would vary from a history based station or a combined station to a counseling station. What are the things that we need to do in the ethical scenarios, and then later on in the lecture, later on in the course, you're going to see how to go about sim and what are the do's and don'ts of the prescription station. So it's a very detailed course, and the main idea behind this course is to make sure that we equip you with the basics of PLAB 2. Okay, we are not going to discuss individual cases, like there are 600 cases in PLAB 2, and there is no point in just going through those 600 cases without sorting your basics. Okay, and this is something which is rarely offered by a lot of academies and a lot of tutors out there, that they don't let you focus on the basics. They're more focused on practice. They're more focused on reading the notes and discussing cases to, like, from the morning till the evening. They have long stretch classes in which they are continuously discussing cases, and if the basics are not right, even though you end up reading 600 cases for 3 to 4 times as well, you would not be able to deliver a consultation in that confidence that you should ideally be giving. Okay, so let's just start off. Okay, and this was going to be a detailed course. Okay, so I would want you all to be very fresh. Get your coffee, or make sure that you have had your breakfast or your lunch, whatever time you are watching this video. But make sure that you are mentally present and you're mentally active, because a lot of information would be given, a lot of delicate information, and a lot of critical information would be given to you, that you need to make sure that is there in your head before you uh, start preparing, and before you start studying for the PLAB 2 exam. Okay, so the first and the foremost thing, the most important thing when you start the station is the introduction. Okay, and introduction plays a very major role, because this is the first sentence that you speak, this is the first thing that you say, and as it is said that the first impression is the last impression. Okay, so if your introduction is correct, if your introduction is done in the right tone, and if your introduction is up to the mark, it will really set a good tone for your consultation. Okay, and it is also very important for the repo building, and as I discussed in the previous lectures, that repo building does carry a significant mark when it comes to your IPS scoring. Okay, so it's very important that your introduction is 100% correct. It is done in the right way, it is done in the right tone. Okay, so I'll discuss how introduction needs to be done for all the station. There are a few variations, like for example, sometimes you may be talking to a relative instead of the patient directly, or sometimes you might be talking to someone on a telephone call. Okay, and in these two scenarios, the introduction would slightly differ. Okay, other than that, the introduction remains same throughout. Okay, like the way that you start the session remains same throughout. Okay, but there is one thing that is called the introduction before the introduction. Okay, so I'll tell you what happens as soon as you enter inside the room. Okay, even before you start talking to the simulator, even before you start talking to the role player that is sitting there, or the patient, you have to enter inside the room and introduce yourself to the examiner and tell what your GMC number is. Okay, Like for example, as soon as you enter inside the room, you're going to say, "Hello, examiner. My name is Dr. Siddiqui, and my GMC number is this." Okay, and to be very honest, the way that you say this, okay, really have a very major impact on your IPS skill. Because just think about it, the GMC examiners listen to the consultation, listen to these introduction, they've been listening to it throughout their life, okay, and they've been sitting there, one by one different candidates are coming and saying the same thing, okay. Sometimes they're taking the exam in the evening or in the afternoon, they're tired because of the entire day's work, okay. So if you go inside and if you just say and introduce yourself that, "Hello, examiner, I am Dr. Siddiqui, my GMC number is this, may I please proceed with the station," the examiner will not get that impression from you that, okay, that this particular person is a happy jolly person, okay. So no matter what the station is, no matter what the type of station is, you have to be energetic, you have to, show your body language, you have to create that aura once you go inside that, "Hello, examiner, I am Dr. Siddiqui, my GMC number is this, may I please proceed with this station." Okay, so even though you haven't begun your session yet, even though the 8-minute timer, yeah, that has started, but you haven't started your consultation yet, but still you're going to create a very significant impact, and automatically the examiner will have an idea that, okay, this person has got good IPS skills. So you have a fair chance of, expecting some leniency and some what do I call it, some advantage from the GMC examiner, that you may get another mark just because you were, energetic in the beginning, and just because you greeted the examiner in a very nice way, okay. So this is called the introduction before the introduction, okay. That is your introduction to the examiner. All right. So once you have done that, and once you have told your name and your GMC number, and once you have asked the permission that, may I please proceed with the station, the GMC examiner would say yes, and then that means that now you can sit on the chair, and now you can formally begin your station, okay. Now, whatever the type of station it is, okay, it doesn't really matter. The introduction mostly remains the same throughout, okay. Now, I'll discuss how to introduce, okay. Let's suppose it's a station where I am an FI2 in the GP surgery. So I'm going to begin my introduction that, "Hello, I am Dr. Siddiqui, one of the FI2s in this GP surgery. Am I speaking to Adam Smith?" And then he'll say, "Yeah, I'm Adam Smith." Okay, and then I'm going to say that, "Can you please confirm your age for me?" And then Adam Smith is going to say, "Yeah, I'm 35 years of age, or I'm 30 years of age." Okay. And then once I have confirmed the identity, okay, I have introduced myself, number one, that, okay, I am Dr. Siddiqui, and I'm an FI2 in this ward, okay. Then my next step is to confirm the identity, and I'll confirm the identity by two ways. Number one, asking about the name of the patient, okay, and the age of the patient. All right. And then once you're done with that, okay, you would want to know that how would you want me to address you, okay. How does the patient wants to get addressed, okay, because Adam Smith may want to be called as Mr. Smith, okay, or maybe Adam Smith is from the LGBTQ group, and he may wants to get addressed as Anna Smith, okay. So you cannot just assume that, okay, if his name is Adam Smith, he would like to be addressed as Adam, okay. Like for example, in my case, my name is Dr. Saro Siddiqui, and usually I like to be addressed as Dr. Siddiqui, okay. So it's a personal preference, okay, and you need to respect that when you're doing your introduction, okay. So after doing that, what you need to do is very important, and it is called the art of asking an open-ended question. Okay, the one that is being highlighted right now, okay. That begins that, okay, I can see from my notes that you're here with some concerns, or I can see from my notes that you want to learn about endoscopy. I can see from my notes you're here with some abdominal pain, okay. And instead of directly jumping onto the history taking, "Can you please tell me where the pain is? Can you please tell me since how long have you been having it? Can you please rate the pain on a scale of 1 to 10 for me? Those are like close-ended questions, okay? And because we are so worried about completing our data gathering, because we are so worried about time management, it particularly gets missed. The open-ended question get missed during our consultation, but it is like very, very important. Always develop the habit of using this sentence, that can you please tell me more about it. Okay, this is what the open-ended question is. Because if you say that, okay, the simulator will start speaking. Okay, and in those 1 minute, or I would say 30 to 45 seconds, in which the simulator will speak, they will give you a lot of information. Okay, they may just complete your entire Socrates, or your major part of the data gathering in just one sentence, that yeah doctor, I've been having some chest pain in my central chest, that is also radiating to my left arm, and it is crushing in nature, and I've been having it for the past 30 minutes. So you see, just one open-ended question gave you the answer to 5 to 6 different close-ended questions. Okay, so always ask about the open-ended question. Just simply, can you please tell me more about it? Can you share some more information about it? Okay, this question is like very, very important. Okay, so what are the aspects of the introduction? Number one, as soon as you enter, greeting the examiner with energy, with a smile, with a big smile on your face, trying to create that environment, try to create that aura. Okay, and then once you start talking to the simulator, introduce yourself, your name, where you are currently. Okay, then confirm the identity of the patient. How you're going to do that? By the name and by the age. Okay, these are the first four things, and then check how the patient wants to be addressed. Okay, after these five things, you're just left with one more thing, that is open-ended question. That I can see from my notes that you're here for you're here to ask about endoscopy. Can you please tell me more about it? Okay, what do you know more about it? Why do you want to know about it? And then they'll go like, yeah doctor, so I've been having some abdominal pain, and one of the doctors suggested endoscopy for me, but I'm not really sure that what kind of procedure it is, and I just want to know some details about the endoscopy procedure. Okay, they will give you the concern. Okay, and they will help you set the tone and help you set the direction in which you have to go in a particular station. Okay, so always focus on the open-ended questions. All right, now let's just discuss some variations. Okay, uh, for the relative scenarios. Okay, let's suppose that you're not directly talking to the patient, but you're talking to one of the relatives. Okay, so the introduction would slightly differ. Okay, slightly it would change. All right, your introduction, okay, and where you are currently situated would remain the same thing. Okay, that I am Dr. Siddiqui, and I am one of the FI2 in this GP surgery. Okay, then you're going to confirm that whether or not you're talking to the right person. Okay, let's suppose that Adam Smith is a relative of Mr. John Smith. Okay, so first of all, you're going to confirm that whether or not you're talking to Adam Smith. Okay, so you need to confirm the identity of the relative. Okay, the change over here is that earlier on, when you're talking to the patient, you had to confirm the identity by two ways. Number one, you had to ask about the name and the age as well, because you were talking directly to the patient. Okay, but in this case, you just need to confirm the name. Okay, there is absolutely no need to ask about the age of the relative, because that is not actually relevant. Okay, the relative is not your patient. Okay, so the age becomes irrelevant in this case. Okay, so do not ask about the age, because this is something, a very common mistake that some IMGs end up doing in the plateau exam. Like for example, in the pediatric station, when you are talking to the mother, you have to ask about the age of the child. Okay, do not end up asking, can you please confirm your age for me? And the mother would be like, why the hell do you want to know my age? Okay, and then there would be an awkward silence, and then you'll be taken aback, and then you'll start doing damage control. Oh, I'm so sorry, I didn't mean to say that. Okay, don't end up doing this. Okay, the relative's age is not important. Okay, and then once you confirm that okay, you're talking to the right person, then you would have to assess two things. Okay, not in fact two, but yeah, in fact two things. Yeah, that, okay, Adam, I can see from my notes that you're related to Mr. John Smith. Okay, can you please confirm his age for me? Okay, number one, his age for me, the patient's age. Okay, and can you please tell me how you are related to him? Okay, so in the relative scenario, it is important to understand, it is important to verify the relation. Okay, let's suppose that I am going to talk on behalf of my father. I would know the age of my father. Okay, somebody close, if it's coming to discuss some medical issues, they would know the age of the patient, that okay, my patient is 65 years of age, my patient is 80 years of age, okay, and whatever the age is. Okay, so the age of the relative is not important. Do not make that mistake, but make sure that you ask that how you are related to that particular person and what is his age. Okay, let's suppose that a mother has come to you with a complaint of her child. So you're going to go like this: that hello, I am Dr. Siddiqui, one of the FI2 in this pediatric unit. Am I speaking to Anna Smith? All right, Anna. And I can see from my notes that you're related to baby Joshua. Can you please confirm his age for me and tell me how you are related to him? And then she'll be like, yeah, doctor, baby Joshua is my 4 months old son. Okay, so they'll answer you that. Okay, they'll give you that verification that, okay, yes, she is the mother and she knows the age, and now that's all sorted. You have verified the relative, you have verified the person, and you have verified the relation as well. Okay, and then once you're done with that, then the protocol is same, that I can see from my notes that you're here with some concerns. Can you please tell me more about it? Okay, the open-ended question would remain the same. All right, so just a slight difference in the relative scenario. Do not ask about the age of the relative. Okay, ask about the age of the patient and check the relation, that how you are related to the particular person that you are speaking. All right, I hope I have made this thing quite clear. Okay, so this is for the scenarios in which the patient is directly sitting in front of you. Okay, in the exam, it would be very common for you to encounter a few stations in which the patient would not directly be there, the simulator would not directly be there. Okay, and it would be a telephone related scenario. Okay, it can be a telephone call or it can be a video call as well. Okay, and they do test this particular skill set, and I'll give you the reason why they test it like this and why do they have this kind of scenarios. Because once you work in the UK, once you're working in the NHS in the wards, you're going to see that a lot of discussions with the relatives and a lot of discussions with the patients is done on the phone call. Okay, sometimes the patient schedules a call with a doctor. Sometimes if a doctor wants to update to the family member about the patient who is admitted in their ward, they often end up scheduling a call. Okay, and a lot of conversations and a lot of communication is done through the phone call or video consultation as well. Okay, so that concept is like very common in the UK. It may not be very common in our home country, but it is there, like very common in the NHS. Okay, so you should be very well aware that how to deal with the telephone scenarios, and how to start and how to begin a telephone related scenario, because there would be some more additional things, some variations in the introduction that you need to do. Okay, number one, if there would be a telephone scenario, it would be written outside that Mr. XYZ is on the phone, talk to him on the phone, and address her concern or address their concern. Okay, and telephone scenario can also have two variations. Number one, you may be directly talking to the patient on the telephone, or number two, you may be talking to the relative on the telephone. Okay, and for both of the cases, there would be slight variation that you would have to do. Okay, and I'll just share it what you need to do. Okay, so the introduction would begin similarly, that hello, I am Dr. Siddiqui, one of the FI2 in this acute medical unit. So that is my introduction, who I am. Okay, and then you're going to confirm, okay, if you're talking to the right person, that okay, am I speaking to Adam Smith? Okay, so all of this thing is just same, there is no difference in this. Okay, but before you start confirming the age and confirming the identity, okay, you need to ask that if it is the right time to talk to you. Okay, because what happens in the NHS is that they schedule a call. Okay, the patient, they request a call, okay, and then the doctor calls the patient back whenever the doctor is free and whenever the doctor believes that it's the right time. So the conversation doesn't directly happen that okay, the patient just called and the doctor picks up the phone and then they're like, hello, I want to discuss this. Like, no, first of all, the patient have to call the reception, okay, or call the hospital administration and schedule a call, and then later on the hospital administration give them a time that okay, the doctors are busy in the round or doctors are busy following the orders, and the doctors are going to call you in the afternoon or the doctors are going to call you in the evening depending on the urgency, okay, and then you eventually end up calling the patient depending on the urgency and depending on your feasibility, okay. So you need to check that okay, whether or not it is the right time to talk to the patient on a telephone call, okay. So this statement is very very important, and once that is sorted, then you can go forward with it, okay. That can you please confirm your age for me and how would you want me to address you, okay. That is something that we discussed in the previous introduction as well, that okay, you have to confirm the age and you have to check that how the patient wants to get addressed, okay. Now, instead of now directly jumping on to the open-ended question, there is an additional thing that you need to take care of, okay. Because the patient is not sitting in front of you, okay, the identity of the patient doesn't just get confirmed because of the name and the age, okay. There's another thing that you need to ask about, and how you're going to ask about it is like, just to make sure that I'm talking to the right person, can you please share the first line of your address with me, okay. This is an additional thing that you need to keep in mind, okay. For all the telephone calls, okay, you need to confirm the first line of the address as well, and the first line of the address would be given to you in the stem, okay, in the question stem or in the case notes, okay. So do not jump onto the open-ended question if you do not confirm the address, okay. If you do not say this line, just to make sure that I'm talking to the right person, can you please confirm the first line of your address with me? If you do not say that, you're going to lose some marks in the data gathering as well, okay. So do not make this mistake of not identifying not realizing that this is a telephone based scenario, okay, and you have to confirm the first line of the address, okay. So these are the two things that are different from the previous introduction structures, okay. And then you would just continue that I can see from my notes that you're here with some concerns. Can you please tell me more about it, okay, the open-ended question. So you can see that in all the variants the open-ended question remains the same, okay. So yeah, I hope that I've made it very clear so far. Now let's move on to the another variation, okay, the last variation of the introduction. Sometimes you might be talking to the relative on a phone call, okay. So the previous three structures that we talked about, okay, you need to mix and merge those things and mix and merge those what do I call it, those tips and tricks and those lines and those structure to make the structure for a telephone call with the relative, okay. And how you're going to do that, I'll just like simplify it for you. That hello, I'm Dr. Siddiqui, one of the FI2 in this ward. Am I speaking to Adam Smith? Okay, this remains constant, okay. Then since it's a telephone call, you have to ask that is it the right time to talk to you, okay. We have discussed this thing that in all telephone calls we have to ask if the a patient or if the relative is available right now, okay, and if it's the right time to talk to the relative, okay. And then you're gonna go like that, okay, Adam, I can see from my notes that you're related to Mr. John Smith, okay. Can you confirm his age for me and how you are related to him, okay. So again, since it's a relative scenario, I'm not going to ask the age of Mr. Adam Smith, I'm going to ask the age of Mr. John Smith, and I'm also going to check how he is related to Mr. John Smith, okay. So that is the relative part that is confirmed, okay. Now since it's a telephone call, a relative is calling, okay, I need to make sure and I need to do another verification, okay. A lot of you must be using Google, and you must have seen that there is a two-step verification whenever somebody else tries to log in to your Google account. Okay, so every time we are doing two-step verifications, name and age, name and age, name and age. For the telephone related scenarios, there is a three-step verification. Okay, name, age, and address. Okay, so we have confirmed the name. Okay, that Mr. John Smith, Mr. Adam Smith. Okay, we have confirmed the age as well. Okay, and his relation to Mr. John Smith. That the third step of verification that is often done in the telephone related scenario is just to make sure that I'm talking to the right person. Can you please share the first line of your address with me? Okay, so a lot of things needs to be done. Your introduction, okay, where you are currently situated at, okay, the relative's identity, whether or not it's the right time to talk to the relative, okay. Then you need to check the relation that, okay, confirm his age, confirm the age of your patient. Can you please tell me how you are related to that particular patient, okay. And then after you're done with all of those things, then you have to do the third step of verification, that was, okay, can you please share the first line of your address to me, with me, just to make sure that I'm talking to the right person, okay. And once all of it is done, the open-ended question needs to be there, okay. The open-ended question needs to be there, okay. I can see from my notes that you have called with some concerns regarding your father, okay, regarding your mother, regarding your child, okay. Can you please tell me more about it? Okay, can you please tell me more about it? All right. So apparently this looks very simple, like it's just 2 to 3 lines that you need to say, but people end up missing important parameters of the introduction. Okay, people end up missing checking the identity. People don't end up introducing themselves. People end up missing open-ended questions, and that leads to a very significant impact on the marks that you score. Okay, so what I want you all to do is to practice the introduction, okay, and all these 4 different variants of the introduction, okay. Try to make one for you. Do not just rote learn this, okay. The one that I've mentioned on the screen, these are like my words. This is how I frame my sentences. This is how I speak, okay. That is why I have mentioned it down in using these words, okay. So do not just rote learn this, because many people are going to see this video, or if all of you just rote learn it and then go out there and just say the same line, you are going to give the examiner an impression that, okay, you are being scripted, okay, you are following some script, because so many people just using the same lines, okay. That doesn't make sense, okay. What I want you to do is that take out the pointers, okay, take out the basics from it, okay. What are the basics? Your identity, okay, where you are, okay, the patient's identity, patient's age, open-ended question, how they want to be addressed, okay. All of these things, these are the basics, okay. And keeping these basics in mind and keeping this framework in mind, the examples that I've shared over here, prepare your own introduction, okay. Like for example, I have written over here that, can you please confirm his age for me and tell me how you are related to him. So instead of this, you may develop your own variant, that can you please tell me the age of Mr. John, and please can you tell me that how is he related to you. Okay, just a minor change, but if you make those minor changes, you would sound natural, because that is your own words, okay. You're not following Dr. Siddiqui's words, okay. So make sure that you prepare your own introductions, okay, and keep on practicing it, keep on practicing it, because it will hardly take you like 10 to 15 seconds to say these lines, but the way you say that, okay, the way you begin your station, like, is very very important, because the first impression is the last impression, okay. And if you don't put your first foot right, okay, then you would sound underconfident, okay, you would not sound natural, okay, you would not have a control on your tone, you would be going here and there haphazard in a panic situation throughout the station, okay. And you don't want to destroy that impression at the very very beginning, okay. So work on your introduction and make sure that you put it right, okay. So this is it for this lecture, in which we discussed about how to properly introduce, okay. In the next lecture, we'll move on to the structure that we need to follow for the medical diagnostic stations, okay. And if you've got any queries, any concerns regarding the introduction, and if something is not clear, then please drop down your queries in the comment box over here, and you can reach out to our socials as well. And if you want to have a personalized mock, a one-on-one mock exam with us, then you can scan the QR code and go to the website, fill in the Google form, and sign up for our mocks as well. Okay, so see you in the next lecture. Thank you.